Dear students, today's topic is very vital topic because we are going to discuss about our vital organ in our body, that is about heart. So the heart here in this image we can see here, it is present in the middle mediastinum which is enclosed in the pericardium. So the heart, it is derived from Greek which means cardia. Cardia means associated with the heart like carditis, cardiac myopathy, so cardiac plexus. So all these terms which are associated with the heart because cardia means the heart in Greek. And in Latin, heart means cor or cordis. So if we see here, the heart is a hollow muscular organ. We can see it is enclosed by the pericardium, within which we can see the heart, which is present in the middle mediastinum between the two lungs. So that is the location of the heart. So the heart is somewhat pyramidal in shape and it is placed obliquely behind the sternum. So here in this image, the sternum and anterior part of the ribs and intercostal spaces are removed. And even the lungs are reflected on each side, and anterior part of the pericardium is removed to expose the heart. So we can see here it is like an obliquely placed behind the sternum and adjoining part of the costal cartilages, so that 1/3 of the heart is to the right of the median plane and 2/3 of the heart is towards the left of the median plane. The heart consists of 4 chambers. Right atrium. So here we can see this is, and from anterior view we can also distinguish right ventricle and left ventricle. So this is right ventricle. Here is the left ventricle. And we can also appreciate little part of left atrium. So these are the 4 chambers of the heart. So on the surface, the atria are separated from the ventricles by anterior atrioventricular groove. So the groove here, this groove which is demarcates the atrium from the ventricle, is the coronary sulcus, which is a right coronary sulcus or right coronary groove. And interventricular groove is the groove which is present here, separating the two ventricles, right and left ventricles. So deep to this fat, interventricular groove which separates the right ventricle from the left ventricle. And the left atrium is separated from the left ventricle by again an atrioventricular groove, which is the left coronary sulcus groove. So these are the grooves which we can appreciate from the anterior aspect of the heart. So externally, if we see, the heart has got the apex. This point is the apex. So the apex is conical and it is formed by the left ventricle. So we can see here the left ventricle forms the apex and it is lies at the level of 5th intercostal space, that is approximately 9 centimeters or 3.5 centimeters away from the midline. So it just where we can feel for the apex beat, and just medial to the mid clavicular line it is present. So that was the anterior view of the heart. So when heart is removed, this is the posterior surface which we are seeing in this image, which is called as base of the heart. So this part is the base of the heart. So the heart is the base or the posterior surface, it is formed by 2 atria. The left atrium makes 2/3 of the base, whereas the 1/3 is formed by the right atria. So this is the left atrium and here is the right atrium, where we can see opening of superior vena cava. This is the opening for inferior vena cava, and this whole thing is the right atrium. This is also right atrium. And we can see the pulmonary veins, the right and left pulmonary veins. These two are the right pulmonary veins, the two right pulmonary veins. These two are the left pulmonary veins. And we can also appreciate arch of aorta and the two divisions of pulmonary trunk. So these are the things which we can appreciate from the posterior view. This part is not under posterior. This is the inferior or diaphragmatic surface of heart. So the posterior surface, it lies opposite to the apex and it is located in front of the middle 4 thoracic vertebrae. Means posterior surface, it is related to T5 to T8 thoracic vertebrae. In lying down position, it is related to T5 to T8 thoracic segments and it descends one vertebra down in erect posture, means it is related to T6 to T9 thoracic vertebra in erect posture. The base is separated from the vertebral column by the oblique pericardial sinus and esophagus and aorta. Let us discuss with the borders of the heart. The heart has got 4 borders: upper border, right, lower or the inferior border and left border. So here I am drawing a line over the upper border of the heart. So this is the upper border of the heart. It is slightly oblique and mainly it is formed by the left atrium. So from the posterior view, you can see the left atrium forms the upper border of the heart and it is related to the ascending aorta and pulmonary trunks. So this is aorta, pulmonary trunks which are related to the upper border of the heart. Let us discuss about the right border of the heart. The right border of the heart corresponds to the right atrium and slightly convex to the right. So this is the right border of the heart, whereas this is the right atrium. So the right border of the heart is formed by the right atrium, which is slightly convex towards the right side, and it extends from the right side from the opening of superior vena cava to inferior vena cava. So we can see the superior vena cava here. This is superior vena cava and below it is related to the inferior vena cava. Okay, next about the inferior border of the heart. Inferior border, we can appreciate it as like an acute margin where it is sharp and thin border, almost horizontal it is present. It extends from inferior vena cava where it opens into the right atrium of the heart and till the apex of the heart, and it is partly formed by the right atrium, mainly formed by the right ventricle, and small part it is contributed by the left ventricle by the apex of the heart. Inferior border separates the sternocostal surface, that is the anterior surface. What you are seeing in this view is the sternocostal surface. So it separates the sternocostal surface from the inferior surface or diaphragmatic surface of the heart. Next about the left border of the heart. So here is the left border of the heart. So the left border separates the sternocostal surface from the left and it descends obliquely, convex, and it is not a sharp border, it is a rounded border and it is formed by the left atrial appendage. You can see the left atrial appendage here, and it is formed mainly by the left ventricle. So starting with the surfaces, the heart has got anterior surface, posterior or the base, and it has got the inferior surface of the heart and left surface of the heart. So starting with the anterior, which is otherwise called sternocostal surface. So what you are seeing here in this image where the heart is present in the middle mediastinum, you are seeing the anterior surface of the heart after removing the sternum and costal cartilages. So that is the reason it is called sternocostal surface. And anterior surface, we can see it is mainly formed by the right ventricle, and it is partly formed by the left ventricle also, and we can see the right atrium also makes the anterior surface, and little part of the left atrium makes the anterior surface. Okay, the next surface which we would discuss is about the diaphragmatic surface, and here we can see the diaphragmatic surface of the heart. This whole area is the diaphragmatic surface. So diaphragmatic surface is otherwise called as the inferior surface of the heart, and we can also see the posterior surface which is called as the base of the heart from this view. So the diaphragmatic surface, it is flat. It rests over the central tendon of the diaphragm. It is mainly formed by the left ventricle. So 2/3 of it is formed by the left ventricle. So this is the left ventricle. And 1/3 of it is formed by the right ventricle. So which are separated by a posterior interventricular groove. So the groove which is present here, this is the posterior interventricular groove. So this is about the inferior surface of the heart. Okay, let's move on to the grooves or sulci which are present in the heart. So first we shall discuss about the coronary sulcus, which are called as atrioventricular sulcus. It is present on the external surface of the heart in the it is like a circumferential manner around the heart and marks the division between the atria and ventricles. So here is the coronary sulcus which separates the right atrium from the right ventricle, which is the right coronary sulcus. Coronary sulcus is divided into anterior and posterior parts. So what you are seeing here in this image is the anterior part of the coronary sulcus, which turns towards the posterior side. The right half of the anterior part is large and it lodges right coronary artery. So let's see the contents of the coronary sulcus. Right coronary sulcus contains the right coronary artery, small cardiac vein. On the left side is between the left atrium and the left ventricle, which is a small sulcus, and it contains the left coronary artery, which immediately divides into circumflex artery and anterior descending. So we can see also circumflex artery in the left coronary sulcus, great cardiac vein and coronary sinus on the posterior aspect. So here is the inferior and posterior side of the heart, where we can appreciate the coronary sinus and also the crux of the heart. Crux is the point at which the interventricular and interatrial sulci cross the coronary sulcus. So this point is called as the crux of the heart, where we can see the interventricular. So this is the interventricular sulcus and interatrial. So this is the interatrial, which is between the right atrium and the left atrium, and also atrioventricular. So this is the left atrioventricular. This is the right atrium. All the 4 points meet here at the crux of the heart. So moving on to the anterior interventricular sulcus. So anterior interventricular sulcus is between the right and left ventricles anteriorly, and it marks the interventricular septum anteriorly. So this one here, which separates this is the right ventricle, this is the left ventricle. So this sulcus which is present anteriorly is the anterior interventricular sulcus, where it contains the left anterior descending artery or anterior interventricular artery and great cardiac veins. So these are the contents of anterior interventricular sulcus. Next, about the posterior interventricular sulcus, which we already discussed. This is the posterior interventricular groove or posterior interventricular sulcus, which demarcates the posterior interventricular septum, that is the posterior interventricular artery and middle cardiac vein. So posterior interventricular sulcus contains posterior interventricular artery and middle cardiac vein. Now let us discuss about the chambers of the heart. We already know that heart consists of 4 chambers: right atrium, right ventricle, left atrium and left ventricle. So that there are 2 atrial chambers which are separated from each other by interatrial septum, and the 2 ventricular chambers are separated by interventricular septum. So here it is, the heart is dissected from the right side, where we can see the right atrium and the right ventricle, and here the septum is the interatrial septum. Here we can see the septum which separates the right ventricle from the left ventricle is the interventricular septum. So here the section is taken at the atrium. So the heart is dissected. It is a cross section at the level of the atrium, where we can see right and left atrioventricular orifices. So the right atrium communicates with the right ventricle through right atrioventricular orifice. So this is the right orifice, and this right atrioventricular orifice is guarded by 3 cusps. So you can see 1, 2 and 3. So it is guarded by the 3 cusps, so it is called as tricuspid valve. The left atrium communicates with the left ventricle through left atrioventricular orifice, which is guarded by 2 cusps. So this is which is guarded by 2 cusps. So it is called as bicuspid valve or mitral valve. Let's discuss about the walls of the chambers of heart. It is made up of the cardiac muscle. So the muscle which is present within the wall of the heart is called as myocardium, which is covered externally by a serous membrane called as epicardium, and internally it is lined by an endothelium which is called as endocardium. And the atria are thin-walled as compared to the ventricles, and they have little contractile power when compared to the ventricles. So coming to the right atrium first. The right atrium has got the anterior rough wall and posterior smooth wall. The anterior rough wall portion, which is called as atrium proper, and it consists of auricle also, and this atrium proper, it is lined with the pectinate muscles. Pectinate means comb-like. So it appears to be like a comb-like muscle which is called musculi pectinati. And even the auricle consists of meshwork of muscle fibers within it, which makes the atrium proper. Whereas the posterior smooth wall, which is situated posteriorly, which is called as sinus venereum. And the sinus venereum is the collecting part where we can see the opening of 2 vena cava. So this is the superior vena cava, and here is the inferior vena cava, which opens into the right atrium. And these 2 parts are separated by externally by sulcus terminalis. Sulcus terminalis is the groove on the external surface of the right atrium, and embryologically it is the junction between the sinus venosus and the primitive atrium, and it corresponds to crista terminalis on the internal surface. So inside the same groove is called as crista terminalis, and externally it is called as sulcus terminalis. And so crista terminalis, it is like a vertical muscular ridge running anteriorly along the right atrial wall, forming the superior to the inferior. So if you see here, between the opening of the superior vena cava and inferior vena cava, the external line is the sulcus terminalis, and same thing internally is called as crista terminalis. So this crista terminalis, it provides the origin of pectinate muscle or musculus pectinati. So pectinate muscles are the prominent ridges which are present in the anterior wall of the right atrium. So interiorly you can see these prominent ridges made of myocardium located in the interior of both the auricles as well as the right atrium. Moving on to the smooth part is called as sinus venarium. Developmentally, it is derived from the right horn of sinus venosus. All the venous channels except the anterior cardiac vein open into this smooth part. So, what are the structures opening? Let us enlist. One is the superior vena cava. We can see here the opening of the superior vena cava, inferior vena cava, coronary sinus, and vena cauda minimi. So these are the structures opening, these are the veins which are opening into the right atrium of the heart. And the rough part, that is the anterior rough part, which is called as atrium proper, it is developmentally derived from the primitive atrium. It presents a series of transverse ridges which is called as pectinate muscle or musculi pectinati. Pectinate means comb-like, so it appears to be comb-like. That is the reason it is called musculi pectinati, which arise from the crista terminalis. So crista terminalis is a muscular ridge between the superior and inferior vena cava within the right atrium, and it runs forwards. These muscle, the musculi pectinati, if we see, it runs forwards towards the auricle, and where the interior of the auricle presents the reticular sponge-like network of muscular ridges. So if you see little more in detail about the right atrium is larger but thinner than the left atrium. So the right auricle, it is conical muscular pouch of the upper anterior portion of the right atrium, and it covers the proximal part of the right coronary artery. Posterior smooth wall, which is the absorbed part of sinus venarium, receives the opening of superior vena cava, inferior vena cava, and coronary sinus. Inferior vena caval opening, it is guarded by a valve which is called as eustachian valve. The coronary sinus opening is guarded by a valve which is called as Thebacean valve, which is a rudimentary valve. Next, about the interatrial septum. Interatrial septum, if you see from the right atrium, we can see a fossa which is called as fossa ovalis. So this is fossa ovalis, which is an oval shaped depression in the interatrial septum, and it represents the site of foramen ovale. So developmentally, this represents the site for foramen ovale, through which the blood travels from the left atrium in the fetal circulation. It has the upper oval, you can see here, the margin is like this. So this margin is called as the limbus, or it is also called as annulus ovalis or limbus fossa ovalis. So limbus is the pronounced anterosuperior margin of fossa ovalis. So it is almost like horseshoe shape. So this is about fossa ovalis, and the margin is the limbus. So the margin, that is the limbus, represents the free interior edge of the septum secundum during fetal life. So inferiorly, the annulus ovalis is continuous with the left end, that is the limbus continues with the left end of the valve. So you can see it continues with the left end of the valve of inferior vena cava. So let us discuss about the triangle of Koch. It is a triangular area bounded in front by the base of the septal leaflet of tricuspid valve. So this is the septal leaflet. So it is bounded by the septal leaflet of tricuspid valve and behind by the anterior margin of the coronary sinus. So this is the coronary sinus. So the margin of the coronary sinus posteriorly, and above by the tendon of Todaro. So here is the tendon of Todaro. So that is about triangle of Koch boundaries, and the tendon of Todaro is the subendocardial ridge which is present. So here the AV node is present. So you can see here, this is the AV node or atrioventricular node. So AV node is located in the triangle of Koch. So we shall discuss about the torus aorticus. Torus aorticus is an elevation which is seen in the anterior superior aspect of the septum. So here it is, anterior superior aspect of the septum is the torus aorticus. It is produced due to the bulging of the right posterior, that is non-coronary sinus of ascending aorta. So let us discuss some clinical aspect of the right atrium. So the spongy like interior of right auricle. So if you see the right auricle and see interior, it appears to be reticular meshwork which is spongy in appearance, which prevents the free flow of blood and thus favors the formation of blood clot, which is called as thrombus, and these blood clots may dislodge during the auricular fibrillation, that is the irregular heartbeat is called as fibrillation. So due to the auricular fibrillation, the thrombus may get dislodged, and these dislodged clots are known as emboli, and such emboli may travel into the pulmonary vessels causing pulmonary embolism. Let's discuss about the interior of left atrium of the heart. Left atrium is thin-walled quadrangular chamber. So in this image, the left ventricle and open part of left atrium, both are opened here. We can see from the left side of the heart. So this what we are seeing, which is the thin-walled, is the left atrium of the heart. So it is quite thin-walled and it is quadrangular chamber and situated posteriorly behind to the left side of the right atrium, and it forms the greater part, that is the 2/3 of the base of the heart. It is the most posterior of 4 chambers lying posterior to the right atrium but anterior to the esophagus. It lies just anterior to the esophagus, and behind the left atrium there is a sinus which is called oblique sinus of serous pericardium is located behind the left atrium of the heart, and it is related, this sinus separates the left atrium from the fibrous pericardium, and fibrous pericardium separates again from the left atrium from the esophagus of the heart. So the left atrium has a smooth wall except a few pectinate muscles are seen in the auricle. So here is the auricle, where you can appreciate the pectinate muscles, few pectinate muscles within the auricle. So these muscular ridges forms the reticulum. There are 4 openings which are the valveless pulmonary veins. So there are 4 valveless pulmonary veins from the lungs which bring oxygenated blood from the lungs and open into the left atrium. There is also a number of small openings which are called as venae cordis minime, which opens into the left atrium of the heart. Okay, here is the image which has taken not in cross section, it is taken in a coronal section where we can see both the right and left atrium. So this is the right atrium, this is the left atrium, this is the right ventricle, and here is the left ventricle. So this opening, though the section is taken along the atrioventricular orifices. So this opening where we are seeing this valve here is atrioventricular orifice. So it is guarded by mitral valve which is called as bicuspid valve. So the anterior wall of the left atrial cavity presents fossa lunate, which corresponds to the fossa ovalis of the right atrium. So this is the fossa lunate, which corresponds to the fossa ovalis of right atrium. So let's move on to the ventricles. So right ventricle, it is more prominent anteriorly, and it contributes to the major part of the sternocostal surface of the heart. And interiorly, if you see, the right ventricle has got the inflow and outflow part. So here, where this is the atrioventricular orifice, right atrioventricular orifice, this is the interior of right ventricle. So the inflow tract of the right ventricle is trabeculated and it receives the venous blood from the right atrium posteriorly through tricuspid valve. So this atrioventricular orifice, the valve what you are seeing is the tricuspid valve. So the outflow tract is the smooth outflow tract is the conus arteriosus, which forms the infundibulum, which expels the blood superiorly to the left to the pulmonary trunk. So it opens into the pulmonary trunk. Here pulmonary trunk is cut open to expose the other side of the heart. So in this image we can appreciate smooth outflow part. And this is inflow. So trabeculated. So we can see the opening into the pulmonary trunk. So this is. So right ventricle opens into the pulmonary trunk. So the trabeculae carni are the irregular anastomosing muscular bridges which form the trabeculated part. So you can see this rough part is because of ridges, the muscular ridges which are present within the wall. And embryologically, the inflow part is from the primitive ventricle. That is, the rough part is from the primitive ventricle, and supraventricular crust, that is which is a C-shaped internal muscular ridge, marks the junction between the trabeculated and the smooth part of the ventricle. So this is the supraventricular ridge or supraventricular crust, which demarcates the rough part, that is the rough inflow part, from the smooth outflow part. So next, moving on to the papillary muscles which are present within the ventricles. They are cone-shaped muscles which enveloped by the endocardium, and they extend from the anterior and the posterior ventricular walls and even from the septal wall also, and their apices are attached to a thin thread-like structures which are called as chorda tendineae. So these thin thread-like white color structures are called as chorda tendineae. Chorda tendineae are the thin white colored thread-like structures which connects from the tip of the papillary muscles to the valves, that is the cusps of the tricuspid valve. So these chorda tendineae, when they contract, they prevent the eversion of the atrial valves, preventing the regurgitation of the ventricular blood into the right atrium. The chorda tendineae extend from the papillary muscle to the more than one cusp of the tricuspid valve. Next, we shall discuss about the moderator band. Moderator band is called septomarginal trabeculum. It is a thick muscular ridge extending from the ventricular septum to the base of the anterior papillary muscle across the ventricular cavity. It conveys the right branch of atrioventricular bundle. So it conveys the right branch of atrioventricular bundle, which is called as bundle of His. So here is the moderator band where we can see the bundle of His, the fibers. You can see here which are splitting. The yellow colored structures are the bundle of His which forms the moderator band. Let's discuss about the trabeculae which are present on the septomarginal, which are called as septomarginal trabeculae, which is an isolated band of trabeculae carni and forms the bridge between the interventricular septum and the base of the anterior papillary muscles of anterior wall of right ventricle. Interventricular septum. So here we can see the septum from the right side, that is the right side of the interventricular septum, which gives origin to septal papillary muscles. It has a small membranous upper part and lower muscular part. So we can see the smooth outflow part which forms the membranous part and lower muscular part. So the inflow part is quite large in size and lies between the supraventricular crust, so it or supraventricular ridge. The other difference between the inflow and outflow part is inflow part is quite rough because of muscular ridges which are due to trabeculae carne. It forms the most of the right ventricular chamber, whereas the outflow part of the right ventricle, that is the infundibulum, which is smoother part, it is due to the infundibulum which gives rise to pulmonary trunk. So that is about the right ventricle. So next about the left ventricle of the heart. If you see the thickness of the wall of the left ventricle, it is quite thicker than the right ventricle because it has to pump to the whole body. So the left ventricle of the heart opens into the aorta, which makes up the major part of systemic circulation. So the trabeculae which are present in the left ventricle are similar to those of right ventricle, but they are well developed and present in two large papillary muscles which are called as anterior and posterior papillary muscles, and there is no moderator band in the left ventricle. So the papillary muscles of the left ventricle are attached to the cusp of the mitral valve. So we can see here, this is the mitral valve or bicuspid valve. So the papillary muscles attached to the mitral valve by cauda tendineae, so which are thin thread-like structures. So the left ventricle has got the rough inflow part and the smooth outflow part, just like the right ventricle, where the outflow part continues into the aorta. So the opening of the left ventricle, it has got left atrioventricular orifice and aortic orifice. So this is aortic orifice, which is guarded by semilunar valves, and this is the bicuspid valve where it guards the atrioventricular orifice. Let's see the differences between the right and the left ventricle. So the right ventricle, it receives the deoxygenated blood from the right atrium and pumps to the lungs through pulmonary trunk. Whereas the left ventricle, it receives the oxygenated blood from the left atrium and pumps to the whole body through aorta, which makes systemic circulation. Whereas the right ventricle is concerned with pulmonary circulation. And right ventricle possesses three papillary muscles, anterior, posterior and septal papillary muscles, whereas the left ventricle possesses only two papillary muscles, which are anterior and posterior papillary muscles. If we see the wall of the right ventricle, it is thinner than the left, so the ventricular thickness ratio is around 1:3. Means the right is 1, where the left ventricle is 3 times thicker. So the wall of the left ventricle is thicker than the right. It is almost the 3 times thicker than the right ventricle. So here is the cross section of the heart taken at the level of the ventricles. So this is the right ventricle, where we can see the 3 cusps here, which forms tricuspid valve. This is the left ventricle. You can see bicuspid. This is the aortic orifice, pulmonary orifice. So the cavity, if you see in cross section, the right ventricle is eccentric in shape. You can appreciate it is almost like eccentric in shape. Whereas the left ventricle, it is almost like circular. So it makes up almost like a circular in shape. And the moderator band is present in the right ventricle, whereas the moderator band is absent in the left ventricle. Okay, let's discuss about the valves of the heart. The heart valves are situated around the fibrous ring of the cardiac skeleton. So here is the cross section of the heart exposing the valves of the heart. So it forms the fibrous rings of the cardiac skeleton, and they are lined by the endocardium, and they include the leaflet or cusp. So you can see the leaflet of cusps of each valve, and they close together to seal the backflow of blood. So they prevent the regurgitation of backflow of blood. And there are 2 pairs of valves in the heart, a pair of atrioventricular valves. So these 2 are the right atrioventricular and left atrioventricular orifice which contains atrioventricular valves, and there are a pair of semilunar valves. So here are the semilunar valves guards the pulmonary and the aortic orifices. So let's start with the atrioventricular valves. So the right and left atria communicate with the right and the left ventricles through right and left atrioventricular orifices. So the right and the left atrioventricular orifices, they are guarded by atrioventricular valves which are respectively right and left. So first we shall start with the right atrioventricular valve which is called as tricuspid valve because there are three cusps. So there are anterior cusp, this is anterior one, posterior cusp, and here is the septal cusp, which are located against the three walls of the ventricle. Next about the left atrioventricular valve which is called as bicuspid or mitral valve, and as the name indicates it has got two cusps, one anterior larger cusp which is called as aortic cusp and a posterior smaller cusp. So anterior and posterior which makes up bicuspid valve. Let us discuss about the semilunar valves also. So pulmonary valve is the semilunar valve which lies between the right ventricle and the pulmonary artery. So if you see, this is the pulmonary having 1, 2, 3 semilunar valves. So there are three cusps, anterior, right and left. So this is anterior, here is right, this is the left. Semilunar valve of pulmonary valve. So it is opened by the ventricular systole and shunt slightly after the closure of aortic valve. Let's discuss about the aortic valve also. Aortic valve is also a semilunar valve and it is located between the left ventricle and the aorta. This valve is between the left ventricle and the aorta and it is composed of three cusps again. Posterior cusp, this is the posterior cusp, and it has got the right cusp, this is right, and this is the left cusp. So its closure at the beginning of the ventricular diastole and causes a second dub of heart sound. So that is about the semilunar aortic valve. Stenosis or narrowing of these orifices. First we shall start with the mitral stenosis, which is the narrowing of the mitral orifice or left atrioventricular orifice. It is most common in young age. Usually if there is a history of rheumatic fever in childhood in these cases. This leads to a rise of left atrial pressure and enlargement of left atrium which may compress the esophagus. Clinical symptoms of mitral stenosis will be difficulty in swallowing, which is called as dysphagia, shortness of breath, dyspnea, and there may be hoarseness of voice also associated, called as Ortner's syndrome. So that is about the bicuspid stenosis. Let's move on to the tricuspid stenosis. Tricuspid stenosis is where the blood flow from the right atrium to the right ventricle is reduced. So the elevation of the right atrial pressure leads to systemic venous congestion and right heart failure. And next is the aortic stenosis. In aortic stenosis, there is the accumulation of the blood in the left ventricle causing its dilatation and hypertrophy. So there is a low cardiac output which may manifest a syncope, that is fainting in exertion. So when the person do exercise, he may faint or that is called as syncope. So next about the pulmonary stenosis, it is like almost always a congenital anomaly, usually associated with the Fallot's tetralogy or Fallot's pentalogy. It leads to hypertrophy of right ventricle. Let us discuss on sounds of the heart which are created by the closure of these valves. So the mitral valve is closed, that is the closure of the mitral valve before the tricuspid valve closes. So it closed slightly before the tricuspid valve by ventricular contraction. So the closure contributes to the first lub sound of the heart. So the first lub of the heart sound is caused by the closure of the mitral, that is mitral valve, and also by the tricuspid valve, which is called M1T1, mitral and tricuspid, on the onset of ventricular systole. The second sound is the dub sound, which is due to the mainly due to the closure of the aortic and pulmonary valves, which is represented as A2P2, which is at the onset of the ventricular diastole. And apart from the lub-dub sound, we may also hear some murmurs. So the abnormal heart sounds are called as murmurs, and they are produced due to regurgitation of the blood and heard when the valves are either stenosed or when the valves are closed improperly, leading to regurgitation of the blood. In aortic and pulmonary stenosis, the murmur is heard during systole, and insufficiency of these valves, they are heard during diastole. And in the stenosis of the mitral and tricuspid, the murmurs are heard during diastole, and in their insufficiency during systole. Okay, let us wind up the anatomy of the heart with the surface markings of the cardiac valves and their sites of auscultation. So first with the pulmonary valve. Pulmonary valve, it is drawn as an horizontal line approximately 2.5 centimeters long behind the medial end of the third costal cartilage. So left third costal cartilage. So this is the first, this is second, this is third. So here is the pulmonary valve. So we have to draw like an horizontal line with 2.5 centimeters length. So that is how we represent the pulmonary valve, and it is the site for auscultation. It is auscultated at the second left intercostal space near the sternum. So it is auscultated at the second left intercostal space. So this purple one. So that is about the pulmonary valve. Next about the aortic valve. Aortic valve is lightly oblique, that is 2.5 centimeters along long line you have to draw behind the left half of the sternum opposite to the third intercostal space. So the site for auscultation of the aortic valve, usually it is auscultated in the second right intercostal space near the sternum. So that is about the aortic valve sound. Next we move on to mitral valve. Mitral valve, it is an oblique line of 3 centimeters long, and it is behind the left half of the sternum opposite to the left fourth costal cartilage. So site for auscultation of the mitral valve, it is auscultated at the left fifth intercostal space, that is 9 centimeters from the midline. Intercostal space, that is left intercostal space. In fifth intercostal space, 9 centimeters, where the apex beat can be heard. So it is over the apex beat we can hear the mitral valve sound. Tricuspid valve. Tricuspid valve is nearly vertical vertical line. It is like an oblique line with 4 centimeters long, and it is present behind the right half of the sternum. So this is tricuspid valve, which is present behind the right half of the sternum, opposite to the 4th and 5th intercostal space. And site for auscultation, the right half of the lower body of the sternum. So here is the site of auscultation. So lower part of the body of sternum. So that is about the tricuspid valve. This is the surface marking of the valves as well as the sites for auscultation. So this completes the anatomy of the heart. Thank you.